Welcome, everyone. Good morning, and thank you for joining us today. I'm Commissioner Lauren Freeland Long, and I represent the City of Novato on the Marin County Commission on Aging, the sponsor of today's webinar. The Commission on Aging is an advisory council mandated by the Older Americans Act. Our mission is to promote the dignity, independence, and quality of life of older persons through advocacy, information, programs, and services. With this mission in mind, today we are presenting Is There a Doctor in the House? Understanding Telehealth and Bridging the Digital Divide. Throughout this course of the pandemic, this topic has had a critical impact on our community, given the protocols that have driven new ways to access medical care. Let me give you a quick overview of what you'll be hearing about today. We'll begin with Ariana Myers, who will share her expertise as she presents telehealth. You've come a long way, baby. And yes, there is a doctor in the house, and he's our second speaker, Dr. Jose Chibras. We'll introduce Dr. Chibras and interview him to learn how patients are benefiting and responding in telehealth and the new normal. Next, we'll hear from Benita McLaren, who manages the county's largest department, Health and Human Services. Director McLaren will walk us through the innovations that technology has sparked in delivering vital county services during COVID-19. Moving into the digital divide portion of the program, we'll hear from our final two speakers, Dennis Rodoni, President of the Board of Supervisors, and Liza Massey, Marin Chief Information Officer. A few housekeeping items before we begin. If you have questions for a particular speaker, please use the Q&A icon at the bottom of your screen. Following each speaker, we will field your questions. If you would like copies of the PowerPoint presentations, they will be posted on the Commission on Aging website at marinhhs.org. Closed captioning can be accessed through the CC icon at the bottom of your screen. Finally, on the behalf of the Commission on Aging, we extend our deepest appreciation to Alan Shavitz for enabling this webinar by generously sharing his technology expertise with us. So let's get started. I'd like to welcome Ariana Myers, Vice President of Health at Donesi Health. Donesi is a global company specializing in contact-free health monitoring, and the organization holds multiple strategic partnerships with Fortune 500 companies. Welcome, Ariana Myers.
Thank you, Lauren, and good morning, everybody. It's my pleasure to be here and my honor to speak to you today about my favorite topic, which is telehealth. And I'm going to begin by sharing my screen. Okay, hopefully you can see that. So I'm making an assumption that if you have signed up and are attending today's webinar, that you are interested in learning and you're curious about telehealth. So we're going to start with a little history lesson. We're going to talk about kind of the emergence of telehealth, how it's developed over time, how we've gotten to where we are today, and then some things that we can look forward to in the future. Okay, so let's start with the very basic question. And I want everyone to kind of cast your mind back. Put yourself a year ago, or let's even put ourselves at the beginning of 2020 before we went into COVID lockdown. And if I had started talking to you about telehealth, you might find yourself actually asking me this exact question. What the heck are you talking about? It may have been a word that you'd heard of, but it wasn't necessarily something that was in your everyday life. And of course, we know that all of that has changed over the course of the pandemic lockdown. Pretty much all of us have had some form of interaction, very likely a teleconsultation with our physician at some point during this time. So we're starting to get a feel for what the term means. It doesn't feel like a foreign term, but I still think it would be helpful to understand that it really is broader than just this idea of teleconsultation. And so let's try and put a definition and a framework on it. There are a lot of definitions out there. They can get very complicated. I happen to like this one, which is short, it's concise. The source is the New England Journal of Medicine Catalyst, which is an online scientific journal that had its inaugural publication in February of last year. And as part of that first edition, they included this very basic definition of telehealth. So the delivery of health care, health education, and health information services via remote technologies. So this is, again, I just wanted you to start to understand that telehealth is more than just a consultation, and it can cover a lot of different areas, including education and IT services. The other thing that I think is worth noting is that there are a lot of terms that have popped up in relation to telehealth. They are they're used in different ways. They're often sort of nuances. And so if you think of telehealth as maybe an overarching umbrella term, you can think of telemedicine as being a little bit more specific to actual healthcare delivery. Teleconsultation being specifically the idea of you Zooming with your doctor to get some care. If you go to the term at the top, virtual care, I quite like this term, and I hear a lot of medical providers using this term because they're thinking about their patients and how can we provide the care to our patients remotely, and this idea of like a hybrid model of digital first, person-centered care. That's a big mouthful, but this is an idea that's starting to take hold in healthcare delivery circles. The other term up at the top, digital health, that's a term that I encounter a lot in industry. So I work in a company that is developing a medical device, and we tend to use the word digital health for applications of our device. The small circles, e-health and m-health, those are, I would probably consider slightly old-fashioned terms. We don't hear them that much. So e-health is but just a reference to electronic health, m-health, a reference to mobile health. A term you do hear quite a bit when you start talking about things like Apple Watches or Fitbits is this idea of a wearable. So something you can strap on, carry with yourself, and have with you at any time. We call those wearables. And so we hear that term quite a bit. The other thing I want to say is this is not a comprehensive list. There's a lot more terminology out there. Language is a living organism that continues to evolve. People may use these terms differently than the way I've just described them. There's nothing set in stone about the way I think about it. But just be aware that this is a growing field and that there's a lot of terminology that's coming out of it. And then just to reemphasize, I've said it a couple of times, that we're, with telehealth, we are talking about a lot more than just having a Zoom call with your doctor, although that's been an amazing development that we've seen come out of the pandemic lockdown. We're going to start then by looking way back. If we take this broader description of telehealth, what could we possibly think of as the very first use of telehealth? And I think that probably what you can talk about is going all the way back to the Middle Ages, when you had a doctor who was potentially stumped by something that was going on with their patient, and they would draft a missive and send it via horseback to a physician in another location asking for advice. And so that's a very humble beginning, as we can say, and it's great that we've moved on from the kinds of healthcare that was taking place back in the medieval ages, and we're able to take things forward. So I've mentioned before that technology is an enabler of telehealth. And so as far as real developments in telehealth, it's it wasn't until we started having technological advances that we were able to see significant developments in telehealth. So a very significant development being the invention of the telephone. So we all know Alexander Graham Bell invented the telephone. That happened in 1876. You may or may not have heard of Dr. Willem Einthoven, who was an exceedingly accomplished man who ultimately went on to win the Nobel Prize. And among his accomplishments was the invention of the electrocardiograph, so the ECG, which he invented in 1903. And being a very smart man who was at the forefront of technology, Dr. Einthoven is also credited with understanding the capacity for the telephone to help in making long distance diagnoses or providing advice over a long distance. So he is credited in around 1906 with the first experimentation in telephone consultations. So then as we go over through time, the next big advancement that I would say is we had the ability to communicate audio over distance, so telephone, a long distance sound. The next big development was the ability to actually share images over a long distance. So if you have a look at this little kind of cute cover from the Radio News magazine, published in 1924, with this incredible futuristic vision of the idea that you could maybe talk to your doctor and see them and have a remote teleconsultation. Back in 1924, that felt like a crazy vision of the future. The first television was invented in 1927. The first television broadcast was in 1928, so it was just a few years later that piece of it came to fruition. But if we talk about the first telehealth that image transmission over a distance, it actually used the telephone as the means of transmission. So they were able to convert a radiographic image into the small digital signals that could be picked up on the other end and reconstituted into a radiographic image. That happened in 1948. But it wasn't long before television itself was being used in telehealth delivery, and the first documented instance of that was the use of it within a closed circuit system, so not an actual airwave broadcast, but you had a telepsychiatrist, you had a psychiatrist on one end and you had a patient on the other end, and the psychiatrist was able to have a consultation with that patient over a two-way closed circuit system in 1963. So let's flash forward. We had telephone helping us out, we had television helping us out, and now we have Dr. Einthoven's amazing ECG invention. Once it was able to be put and shrunk down into a portable form, there were a lot of new applications that opened up, and specifically there was a program that was started in Norway in 1995 where they put the portable ECG into the ambulance with the first responders. And so then, as you know, when someone has an infarct, a heart attack, or a potential heart attack, the ability to respond immediately with appropriate treatment makes a big difference in the outcome for that patient. And so by having the ECG available at the patient's home, so the first responders could take the ECG in and perform one right then and there, and then as they were transporting the patient to the hospital, the ECG would be transmitted and read and interpreted by a cardiologist at the emergency room, who could then interpret, make a diagnosis, and inform what the immediate treatment should be. So treatment could begin en route in the ambulance. And this was hugely successful. It made a massive difference. It improved patient outcomes by 15 to 20%. And nowadays, we don't think twice of it. You absolutely expect to have an ECG in an ambulance going forward. So flash forward to today, There's been developments over time. There's been uptake, rather slow, of telehealth. And if I talk about technology being an enabler of telehealth, then we really have to talk about the COVID-19 pandemic being a catalyst for telehealth. And the use of telehealth has exploded over the course of the last year. The statistics back that up. So we saw where approximately 11% of patients had used some form of telehealth in 2019. That number is way up. 3/4 of people in the next year were using telehealth. From the provider side, they reported increases in the number of telehealth visits from between 50 and 175 times as many of those visits versus pre-pandemic. And the potential is really huge. So of all the CMS spending that's being done, it's estimated that about $250 billion of that could be virtualized. And so we can expect to see just continued adoption and virtualization, an overarching trend of decentralization of healthcare delivery from the hospital or from the clinic into the home. So here's an example. We don't have to be talking about a long distance for something to be telehealth. And in this case, the example I'm showing you is a doctor, and this is a robot. The picture of this robot is the actual robot that was used to treat the first patient who was diagnosed with COVID-19 in the US. This person was diagnosed. They were actually put into then a sealed chamber, and that was kind of a gurney, but it was enclosed, and then they were transported into a sealed off room and let out of the gurney. And at that point, all of the interactions between that patient and their doctors were taking place via this robot. So we weren't talking about trying to cover a long distance here, but we were actually talking about telehealth being a means of infection control. So that's just another couple of other things to keep in mind. Doesn't have to be a long distance. Infection control is one of the potential benefits of telehealth. And then you can imagine in the future, there are actually robots out there that people are making available for home visits. So maybe you get a knock on your door and it's Mr. Roboto on the other side at some point in the future. So here's another great example. This is a wearable armband put out by a company called Current Health. It received its FDA clearance in 2019, and it was approved at that time for monitoring your vitals at home. So the idea here is that if you've been in the hospital, you've had some kind of surgery, there's a really critical time period post-discharge during which you want to be able to know whether anything is changing, if the person is decompensating and needs further treatment, et cetera. And so devices like this armband provide the ability to perform remote patient monitoring. So that phrase, remote patient monitoring, RPM, that's another one of these terms that's come out of the development expansion of telehealth. And it's pretty amazing. Strap it on your arm, and all your vitals are readable by the doctor at the hospital. If something goes wrong, they get an alert and they can contact the patient for further action. Another area of healthcare that is extremely well suited to remote patient monitoring, telehealth, is chronic conditions. So the conditions that are associated with the elderly, highly correlated to the elderly, like diabetes, cardiovascular disease. There are quite a few actually, live solutions out in the market that people are taking advantage of today to, for example, monitor their blood glucose and manage their diabetes, and it provides similar benefits. So you can read your blood in home. You can get an immediate feedback Your doctor can be alerted if there's an issue, if something falls outside of the normal range, etc. And these are actual products that are out in the market right now. And then there's some kind of cool stuff that's happening. It's especially in and around artificial intelligence and machine learning. And I've just shown two examples here. I think both of these are interesting because they really are leveraging technology that you already have in your smartphone. So you don't need a special device. You don't need extra equipment. You pick up your phone. The Hero device is, the Hero application is put out by a company called CardioMed. And their claim is that they are able to detect, just by listening to your voice, they claim they can detect the accumulation of fluid in the lungs, which can be a sign of exacerbation of heart failure. So that's pretty amazing. The one next to it, the Bina.ai, really looks at the color of your skin and is able to extract from that quite a few health and wellness parameters and give you feedback there. So all of this stuff is still under development. These are out in the market, but the way that artificial intelligence and machine learning works is that the more data they gather, the better the algorithms work. And so it's kind of amazing what you can already have happen, but we can also expect more in the future. This is a very active area of telehealth that is underway right now. So the future is not so far away. And so this has been a little trip through time then. I hope you have an understanding and a perspective on telehealth that is new to you. My takeaways that I hope are pretty clear is that, number one, we're talking about a lot more than just a Zoom call. Technology has been the enabler of telehealth all this time, but COVID-19 has been the catalyst of telehealth over the last year, and it's really made a big difference in adoption and innovation and etc. Chronic care management, I expect we can see that that will become kind of the basic approach to a lot of dealing with managing your chronic conditions, especially those with the elderly. And then I just want you to understand that this idea of more and more incorporation of technology into the delivery of healthcare means that we're not going to talk about telehealth going forward. We're really going to, when we talk about health, there's going to be this idea and concept that technology will be part of it, remote care delivery will be part of it, decentralization of healthcare from the hospital or the clinic into the home is going to grow and grow, and the future that we're talking about may have you physically going to the doctor quite a bit less than you have been in the past. So that was kind of what I wanted to talk you through, and I'm happy if there are questions, I'm happy to take them.
Thank you so much, Ariana. That was a great trip through the past, present, and into the future of telehealth. We appreciate it. I'll just remind our audience again that there is an icon at the bottom of your screen for Q&A, and it looks like we have a question. Ariana, are there concerns regarding people who may have symptoms from exposure to electromagnetic fields and radon or radiation? Are you aware of any concerns that telehealth presents in that regard?
So of course, there are always concerns with pretty much any activity you engage in. And if you are using your devices, there are concerns about, even concerns about too much exposure and how that can impact you mentally. but this is, I mean, this is not the same thing as an X-ray, right? If we're using our iPhone and getting more information on it, it's not really an incremental exposure or risk. But that said, as part of what the FDA is there for. So the number one goal of the FDA in clearing a medical device for marketing in the US is to ensure that it's both safe, it has safety and efficacy. Those are the two factors that the FDA takes into account. So if there is a concern, I would say caveat emptor when you start pursuing say consumer solutions, then you might want to take extra care. But if there's an FDA cleared product that you're working with, then you can feel fairly confident that it's been tested and it's also being monitored post-market.
Thank you. There's another question here about how is blood pressure monitored remotely?
So there are actually solutions for monitoring hypertension, and it would be you're still going to need to put on a sphygmomanometer, armband, your blood pressure cuff. But they have them now where they're very automated. So essentially imagine a mobile application similar to the ones we saw for diabetes. And then you have an armband, a blood pressure cuff that you use. It tightens automatically. It takes the reading. It connects via Bluetooth to your app and sends the reading through. And then you have the same kind of connection with the doctor. So there are solutions that are out there like that now. I think there's one called Hello Heart that does that. And there's some other ones that are out there now. So definitely hypertension is very conducive and can be monitored using remote patient monitoring.
Thanks, Ariana. So appreciate your presentation today. I'm going to turn this over to Jean Gunn.
Thank you. Thanks, Ariana.
Thank you.
Good morning, everyone. I'm Commissioner Jean Gunn, representing District 5 on the Commission on Aging, and I'm honored to have the opportunity to interview Dr. Jose Chibras today. Dr. Chibras is the Chief Medical Officer of the Marin Community Clinics. And in addition to overseeing clinical staff, Dr. Chibras practices internal medicine with a strong focus on preventive care and chronic disease management for adults. So welcome, Dr. Chibras.
Good morning. Thank you so much for having me, Jean. And then Ariana, what an excellent presentation. I really enjoyed listening to that eloquent presentation. Thank you and good morning to everyone.
So let's get started. My first question of you, Dr. Chibras, is I understand that Marin Community Clinics first began providing healthcare to uninsured and low-income Marin residents in 1972 with volunteer doctors and nurses seeing patients in church basements. Please talk to us a little about what the organization looks like now, almost 50 years later.
Right, absolutely. Listen, what I want to do is just give a little history, like Ariana did a little bit about community health centers, and let you know the community health centers were started during the President Johnson administration in 1965. And you know, there's a physician who started his first clinic in Boston, and now community health centers, there's over 11,000 sites in the United States. There's 1,400, and Marin Community Clinics is one of those one of those clinics, and we started in 1972. And like you said, most community clinics started with modest, with a modest beginning. And today, you know, fast forward 50 years, Marin Community Clinic serves over 40,000 residents in Marin County. We see well over 250,000 visits a year. And I'll say that again, 250,000 visits a year. What kind of services does Marin Community Clinic provide? Well, first I'm going to tell you they're excellent. We're usually ranked nationally, you know, out of the 1,400 parent community health centers across the country, we're using the top 10 percentile. And in 14 counties in Northern California, as Partnership Health Plan of California presents quality awards, we're usually in the top 1 or 2 percentile. We're actually, for the largest health centers in Northern California, we're in the top. So Having said that, what kind of services do we provide? Very important for geriatric care are cardiology services, eye cares. We're in a collaborative with UC Berkeley. We have orthopedic surgery. We have an internal medicine department, family medicine, pediatrics, OBGYN. There's about 1,200 deliveries we do in the hospital at Marin General, Marin Health, correction. And our pediatricians also follow the infants there. We have urology, podiatry, dermatology. And so we have dental, which is seven days a week. We see over 75,000 dental visits a year, open 7 days a week. And that's really important. And then integrated behavioral health. We have adult and child psychiatry, psychology, LCSWs. And, there's many other services, but, we've really become an organization that's important to the community's health. And so, I just want to thank all the staff that we have during this pandemic. Being open, we've delivered vaccines since January, from 8 in the morning until 8 at night, Tuesdays through Saturdays. And so, all the testing that we did. So we've been available to take care of folks in our community
Amazing.
since 1972. So thank you for letting me kind of share with folks what it is that Marin Community Clinics is doing.
It's important information, not only for the community, but for the Commission on Aging to understand better how Marin Community Clinics operates and how successful you've been. Before I get into our next question, let me just remind our audience, if you have questions for Dr. Chibros that come up during his answers to our questions, just put them in the Q&A that you'll notice at the bottom of your screen. As you know, Dr. Chibros, Marin has one of the oldest populations in the state. How has telehealth impacted healthcare for older adults?
I'll share with you. We've been able to provide telemedicine and telepsychiatry for years prior to the pandemic. Obviously, with the pandemic, as Ariana mentioned, it became paramount for patient safety and staff safety. What we've been doing prior to the pandemic is offering, for example, dermatology. And dermatology is something we've been using telemedicine and telehealth for a long period of time. An individual is able to upload a photograph of a skin lesion that's of concern to them. The dermatologist reviews it. They can either have a video visit or an in-person visit. Obviously, there's some limitations to telehealth. I mean, if you're going to have a biopsy, you're going to come into the clinic and the dermatologist is going to take care of that lesion. Something else that we've been doing for years is with UC Berkeley, we've been able to do retinal eye exams with remote care. In other words, you can have a specialist, you come into the clinic, you have a retinal eye exam done with some fancy equipment, and then they send it to UC Berkeley and some of their professors will review some of the images. And so that's another real important service that's been helpful for geriatric care. Additionally, behavioral health. We can't forget how important it is to be able to have a counselor, an LCSW, a psychologist, or a psychiatrist. And like you mentioned, 1/3 of the population in Marin County is over the age of 60. 1/3 of those individuals live alone. If you have an individual that's having difficulty moving, getting in and out of a wheelchair or walker, having to come to the doctor's office, a son or daughter has to take time off work, it is very challenging. So there are some times where, having the individual come less into the office and do some of the remote care is appropriate in order for us to be able to take care of folks like we talked about with monitoring, for example, for blood pressure. If I start somebody on medications today, in 2 to 4 weeks, we check again to make sure that medication is working, there aren't side effects. And, there are some devices now with smart devices that we can upload information in and monitor folks' blood pressure. I'll tell you, there's several ways we can check blood pressure. One is, Ariana mentioned, there's Bluetooth technology, and I'm sure a lot of you have using that. Some folks don't have the equipment, they don't have the hardware and software, and I think some of the other guests will talk about the digital divide. But we can also visually, like we're doing right now, we can have a nurse right now show you how to use a blood pressure cuff in the office and go home 2 weeks later, and we can watch and make sure you're doing it correctly via Zoom, like we're doing right now with secured systems. Or we can do is have somebody do a glucose check, and we can go over the medication regimens and do those things that we do. And even for transition of care, I think there was what's very important is somebody's discharged from the hospital and you're not feeling well. You may not want to get back into a car and get into the doctor's office, but a nurse and a doctor with the family around, we can check your medication, do what we call medication reconciliation. We can see all the new meds that you got from the doctors, the hospitalists, and make sure, well, first of all, that you understand how to take it, make sure that you did get the medication that you should have gotten, and make sure that you're taking it appropriately in a timely fashion, and that you understand what either the patient or the family or the caregivers understand specifically what we're doing. So those are some examples of some of the things that we're doing. And I just want to let you know that we do have 2 facilities in Marin County that are dedicated to geriatric care. Our newest facility opened in Greenbrae on February 3rd. During the pandemic, we opened another facility that specializes right next to Marin Health in geriatric care. And right across the street there in Larkspur, there's another facility. And within that facility, we have a pharmacy. And so we can deliver pharmaceuticals to our patients, which was very important during the pandemic, to make sure that their medication was delivered to their home instead of putting them at risk to come in. So we have a pharmacy there that's able to provide medications to folks. And that's where our dermatologists and our cardiologists practice. And we have psychiatry there as well. So I just want to let folks know that although it was a very, very busy year for us, we're proud that we opened another geriatric facility for the folks that are requiring a primary care provider or physician in Marin County.
Terrific, terrific. How do you determine, I'm curious, how you determine the most appropriate platform for a patient's visit? For instance, how do you decide if you're going to use the telephone or a Zoom conference?
You know, there's some protocols that we have in place, and there's some great reasons that folks may be able to access remote care, and there's some reasons that absolutely shouldn't have remote care. And I'll give you some examples. Our dentist colleagues, I could tell you that if you need a filling or if you need a crown, it's not going to happen virtual. And so those examples, if somebody has a toothache, for example, it really makes more sense for somebody to come in physically. We've been doing this all through the pandemic. And as mentioned, we're open 7 days a week, and a person needs to be seen in person for that. Another example is eye care. If you get a foreign body in your eye, if you're doing something at home and a piece of metal or wood falls into your eye, it makes no sense for me to see you remotely. It makes more sense for you to be seen by one of our optometrists in the clinic where they have the equipment and they can help you get to either take care of it there or send you to an ophthalmologist where you require additional care. Having said that, there are a lot of areas where we can do a lot of patient education, for example, remote. There's no reason for you, if you're working with a nutritionist, especially during the pandemic, for you to put yourself in harm's way to get in a car and go into a health center where it's probably safer for you to, like we're doing right now, speak to a nutritionist about some of your goals, some of your objectives for what it is that you want to do. You know, that's appropriate. So the cognitive behavioral kind of specialties like behavioral health, if you're having, marital problems, there's a lot of stress, there's a lot of anxiety, insomnia, the counselor can give you some ideas to what to do. A psychiatrist, for example, if you've got a great relationship and everything is stable, to prescribe medications for somebody who's stable, who you've seen in the office, for follow-up visits, it's totally appropriate to do that. Again, the idea is in this century, for a lot of the health education, in the last century, it was a sick model of healthcare. In this century, it's about wellness, it's about keeping people well, it's about keeping them safe. And there's no reason to get somebody who's 80 or 90 into a car and drive across town. And you know how the traffic is on 101. It really isn't the best use of folks' time. So, but there are a lot of reasons why folks should go to the ER or go to the hospital if they're not well, if they're having chest pain. We looked at how we monitor EKGs and those kind of things. But definitely, if you're ill, it's best to be seen in person.
Great. What kind of feedback are you hearing from patients in terms of access and satisfaction with the telehealth services they're receiving?
I think like everything, there's going to be pros and cons for everyone. And so, for those of us that are able to access Zoom, or we don't use Zoom, we use different platforms that are secure, but just like this with the video conferencing, if you're able to do it from home and it's appropriate, it's a great device, and technology is really important to be able to to help folks where they're at and not take so much time off work or the commute that we talked about. But there is a digital divide. So some of the patients that we take care of, we use a platform like this to be able to have a consultation like most folks. But some of the folks that we take care of, if you don't have high-speed internet, or if you live along the coast, West Marin, you may not have the ability to be able to do this with high-speed internet, and it's kind of choppy. You get in and out. It doesn't work as well. So and for some other folks, some of us may have a private place to speak to a psychiatrist or behavioral health person, a private discussion. And if you live in a multi-generational household where you don't have that privacy, if you're living in a place with 4 or 5 other folks and you can't find a room to chat and have a private discussion, that's an issue. So telephonics or using a telephone or a telephonic consultation sometimes is very helpful. Folks can go take a walk outside and be by themselves and find some privacy. So overall, I think that folks, for patient safety during this pandemic, it's been essential. It's been great. Feedback and patient satisfaction has been great. I think that there's a lot of pent-up demand now that folks have postponed their care, and we're seeing more folks in the clinics now. But I think that telemedicine and technology, as Ariana eloquently kind of gave the history of, is something that's going to be very important going forward, and it's something that we're going to utilize. And I'll give you an example of how it is that it's going to happen. So if you've got elevated blood pressure, we have care teams, and what they're going to do is monitor your blood pressure real time. And so if your blood pressure is not well controlled, we're not going to wait 3 months for you to come into the office for me to say, hey, your blood pressure is not well controlled, and now you're at risk for heart attack and stroke. The idea with prevention is to catch it early, not wait 3 months and intervene and say, listen, are you taking your medication? Is the medicine still in the pharmacy? Are you taking it correctly? Maybe we need to make a medication change. Maybe you're drinking too much caffeine, but to not wait 3 or 4 or 5 months and put you at risk for heart attack and stroke. So I think the feedback with telemedicine and the ability to access folks real time when it's convenient for them and make it accessible is extremely important.
Terrific. Equity is something that is really a focus for the county and for the Commission on Aging in particular. And the numbers reveal that low-income communities of color have been disproportionately affected by a wide array of health conditions, especially COVID-19. How has telehealth contributed to remedying inequities and removing barriers?
I think just being able to access their healthcare provider, individuals being able to have real time, not take time off work, and especially when it's, most of the folks that were really affected across the country are those individuals that had essential jobs, that were working daily for all of us to make sure that we had food, make sure that, we were getting caregivers that were taking care of our grandparents, our family members, our loved ones. And so how have we been able to help them? Well, if they were ill, hopefully we were able to either they were able to access their physician or a nurse or a care team from the safety of their home if they were sick, and if they had COVID-19, you would be able to take care of them remotely. Some of the other things that telehealth is still something that's of concern, I think, to all of us, is the digital divide. Not everybody has high-speed internet. Not everybody has the software, the computers, or the software, the hardware to be able to do this. So there's still, a lot of work that's going to be done in Marin County and across the country to make sure that school children are able to access remote services for schools. Hopefully now they're going to go to school and go back to something that's a little bit more normal, since we're number one in the US for the number of vaccines that have been delivered in Marin County. That kudos to everybody who's been part of that. But hopefully children will get back. But typically it's the school children that have the hardware and the software and can teach the parents how to access their medical provider remotely. We still could talk about the social determinants of health and life, and this world isn't always fair, and not everybody lives in a 3,000 square foot home with 2 individuals, whereas folks in the Canal, for example, might live in a 3-bedroom apartment with 3 families and 9 folks in 1 bathroom. And so it's really about housing, addressing the social terms of health, And I have to be modest and share with you that healthcare, in the whole scheme of taking care of individuals, is only 20% of what we do. 80% of healthcare is outside of our four walls, and that's, socialization, housing, education, clean water, clean air, and looking to sustainability and making sure that we take care of our earth. And so it isn't just about physicians, it's about all of us. And if anything we learned with this pandemic is that it really does take a village to take care of everyone, and collaborating with the county health department and the hospitals, faith-based organizations, food banks. And so what did we learn? We learned that there's still disparities, health disparities, and there's disparities in this country. And this is the greatest country on earth. It really is. And we have so many resources that I think that, if anything, and I always believe, if there's any place where we can make innovation, and it's disruptive innovation, it's in Marin County, because we have some of the brightest and best individuals that are able to make changes. And one example of that is how we're #1 in vaccines. And so, even the staff that we have at MCC, we've got over 600 staff. We have some of the best physicians in the country, some of the best outcomes. And I think if we partner with all of us together, we can level the playing field for everybody in Marin County. And I think that if anybody can do it, I think Marin County can do it, because we've had all the resources and great people with great hearts. So thank you for asking that question.
Oh, no, great. You're inspirational. It's wonderful. I appreciate your all of your comments. Let me move over to the questions. One of our audience members is asking, who can access the Marin Community Clinics?
Yeah, that's a great question. Hopefully, since 1965, all community health centers are exactly that. They're community health centers. Anyone, we take all insurances, we take Medicare, we take Medi-Cal. And I just want to point out that, and I didn't say this when we talked about dental care. I don't know if folks know, but Medicare does not cover any oral services with dental care. And so, that's something that we want to make folks understand, is that we have the ability to take care of those individuals who have insurance, that don't have insurance. We have certified enrollment counselors that try and help folks get into some kind of insurance plan. So the answer is, we're a community health center. We're available to take care of, we want to take care of anybody who doesn't have a primary care physician or that requires care. We'd love to see anybody. And I think that's across the country with any community health center. It's so important that folks do have access and do have a primary care provider.
Great. Okay. Another audience member talks about an article that was in the IJ earlier this week, exploring a new health advice application that's being adopted by Meritage, Marin IPA, and there appears to be some confusion regarding advice versus diagnosis.
Yeah, I would let somebody from that organization speak specifically to that app, but there are a lot of apps where they do have algorithms where they can answer some questions, but those are questions that you may have, like if you have, there's questions you might get an answer to, but it's not going to be, I wouldn't rely on that for specific diagnosis. Healthcare is personal.
Right. Okay, great. Here's another question. How are Marin Community Clinics funded?
In part, I'll give you a different story. In 1960, community health centers were funded, probably 95% of their budget was from the federal government. In 2021, Marin Community Clinics probably receives about maybe 3 or 4% of their monies from the federal government. What we do is we provide services to everyone, and we do receive some funding from the federal government. We do receive some from our county partners. They're philanthropists that donate to the community health centers, and we also bill insurances. We also bill Partnership Health Plan of California. And so, like everything else, primary care and taking care of folks is extremely difficult and challenging for everyone. And so, we have pharmacies, we have radiology, and those services do cost our clients, our customers, depending on what it is, but we do have sliding scales and we make it very affordable. And the federal government makes it very clear that we don't turn anyone away for their inability to pay, but we try and enroll them into programs. We try and help them make sure they do have some kind of coverage.
Okay, great. Well, we have a number of questions about income criteria. So to be able to access the clinic if you don't have health coverage. So it sounds like you've answered that with the sliding scale.
There is no income. If you need health care, please go to any community health center, specifically Marin Community Clinics. We're here to take care of everyone.
Terrific. Okay, great. Linda Jackson from the Aging Action Initiative asks, what specialized training is provided to clinic staff so they're most responsive to the telehealth needs and challenges of older adults?
That's a great question. And so with our geriatric clinic in Larkspur and the new one in Greenbrae, what we do is we work with our staff, and there's certification out for the EDs for geriatric care. So we've kind of modeled the systems that they put in place to train our staff. And that is specifically to make sure that individuals, for example, we have bariatric chairs. So the environment has to be different for geriatric folks. We make sure that in the bathrooms, for example, it's safe. There's safety little bells in there if somebody needs some help. Making sure that when we communicate with older folks that we train our staff to increase their volume and turn down the cadence of their speech, and same on the phone. These are just some examples. We also do dementia screening, and we screen folks for different kinds of illnesses that they may not know. But we also do screenings to make sure that folks are safe at home. And so there's a series of screenings that we would do for pediatrics, but with geriatrics, it's different in a sense that we want to make sure that we're screening folks every time they come in to make sure that we have beard criteria, to make sure that the meds that they're receiving are appropriate for folks with their kidney function and their age. And so there's a series of guidelines for taking care of folks that are across the country that we try and train our front office, our nurses, our doctors are usually internal medicine doctors, or if not, folks that are trained in gerontology. And so that's a great question, and I appreciate that you asked that question.
Terrific. Our final question, I think you've covered a little bit, but maybe you could go into a little bit more depth. One of our audience members is asking about the availability of mental health services. Can you talk a little bit about specifically what those services might include?
Yes, we have adult psychiatry, and we have adult psychologists, LCSWs, and MSWs that help in an integrated fashion. I have to tell you, it's been a little bit challenging. We used to sit hand in hand with our psychiatrists and our social workers and our behavioral health staff literally in the same buildings. And now we've kind of separated. We're all coming back together. But the idea when it's integrated, it's not co-located. I mean, literally the psychiatrist is in the building with myself. And if I'm taking care of somebody, for example, somebody that I just saw yesterday who recently had a small infarct and is really, really stressed and upset about it. Any of us that would have a stroke, it's life-changing. And so I'm not a psychiatrist, I'm not a psychologist, but I could reach over and ask a colleague of mine to do a warm handoff and have that person go in and meet the person, both of us together, introduce somebody to my colleague, which is what integrated behavioral health is, and have that person meet this individual that may need some help during this stressful time, and have this individual meet that person real time right there and arrange either for a telemedicine visit, it could be a video visit like this, or in person, whatever it is convenient for the patient. One thing I do want to make and emphasize is this is about being patient-centric. This is about giving the patient the choice, not when it's convenient for me, but when is it convenient for this individual who's had a stroke to be able to see this behavioral health person. And so they can develop a relationship. And, if it requires medication or a psychiatric warm handoff, the psychiatrist may be available, maybe not. Maybe they're available via video, and we can do that real time. And the other thing is we have a psychiatrist in San Rafael, because we got clinics in San Rafael, Novato, Larkspur, and Greenbrae. If the psychiatrist is sitting in Greenbrae, for example, and I'm in Novato, we may be able to chat like this, the three of us, and have a an integrated visit with technology, which is very helpful. We've been doing this for years. And so I hope that's kind of what you're asking about our integrated health. And one last thing is we have a complex care team, which is part of our behavioral health. And if somebody has multiple medical issues and are getting out of the hospital or going in and out of the ED, we have individuals, nurses and nurse practitioners that follow those individuals in a small little panel. They don't have thousands of people, but there might be 30 assigned to a little group of folks that watch those individuals like they would watch your children swimming in a pool to make sure that they're safe. And so, and it's a team of individuals that are watching those individuals that require a lot more care than somebody who's 35 and rides a bicycle and maybe takes one pill for blood pressure occasionally, or that's the only pill they're taking. I shouldn't say occasionally, but it's nice if they would take it every day.
Terrific. Well, Dr. Chibras, your presentation and your responses to our questions have just been terrific. Thank you so much. And I hope this is the beginning of a relationship that the Commission can form with the Marin Community Clinics so that we can develop a relationship and be supportive of the work that you're doing and get the word out to our constituents, the older adults throughout Marin. So thank you so much. I know you're busy these days, and I really appreciate the time and effort you've put into participating on our panel today. Thank you.
Thank you so much. It was my pleasure, and thank you for allowing me to share some of the things that Marin Community Clinics is doing for the community. Thank you so much. Have a wonderful day, and everybody stay safe. Thank you.
Thank you. Well, that was terrific. Our next presenter, Benita McLaren, is the Director of Health and Human Services for Marin County, and she's a fellow of the American College of Healthcare Executives. Ms. McLaren manages the largest county department, which includes social services and public health. So she and her team have been very busy this last 15, 16 months or so. Welcome, Director McLaren.
Good morning. Thank you, Jean. I really appreciate the opportunity to be here today. I'm going to try to share my screen for my presentation. Hopefully you can see it. Can you see it now?
Yes.
All right. Excellent. Okay, well, we're going to go ahead and get started. Oops, here we go. As mentioned, I'm Benita McLaren, and I've been here with the county almost a little bit over a year and a half. And I'm really happy to have the opportunity to serve here in Marin County. Let's see, what's the next slide? The mission of the Marin County Health and Human Services is to promote and protect the health, well-being, safety, and self-sufficiency of all in Marin County. And we're really, really committed to our mission. We think that during COVID, especially, our mission has been so important to the community, and we're very proud to be able to support the community with this mission. As has been stated, we are a large department for the county, and we have over 40 programs. We've had 12 locations in the county of Marin, and our vision for Marin Health and Human Services is that all in Marin flourish. And we're really committed to that all piece of our vision and all in our mission, that everyone gets to benefit from having a prosperous and healthy life. So we have 4 major divisions that has been mentioned. We have our administration division, we have behavioral health and recovery services, and we have social services and public health. And all of our divisions work separately, but also very integrated to make sure that we can provide the best services possible for our Marin County residents. And we really strive to be innovative in our approach and creative as we try to meet the needs of our diverse community. I'm going to talk.
Benicia, your notes are also showing. If you have a way of just showing the slides without the notes, it would be better.
Thank you. Sorry, I'm not sure why that is. Let's see. Let's try again. Are you seeing the slides or the,
Seeing both, but go ahead, not to interrupt your flow.
all right, sorry about that. We'll try to go on through it. The notes are helpful too. I'm going to talk a little bit about, and I apologize that you can see the notes, but the notes will help you in understanding what I was going to say. I was going to really just talk about 4 major areas around delivering services during COVID. And I'm going to talk about coordinating our pandemic response efforts, providing informational updates and community forums, coordinating service delivery, and providing direct services such as therapy during COVID. We have learned to maximize our use of, during COVID, we have learned to maximize our use of technology. And we are really excited about the things that we've learned during the pandemic. We believe we become more efficient with our use of technologies and for planning and coordination. And we believe we've become even more accessible and provided more information and education to our communities. And we believe we're able to do a better job at reaching out to residents using technology to coordinate services and provide direct care. Coordinating on this issue of coordinating our pandemic response efforts. During the pandemic, we learned early that the pandemic response efforts using virtual technologies allowed our staff to be able to stay safe as well as our clients. We became very efficient conducting business, planning, and coordinating efforts. And we've also used electronic methods to track our employees' work status. We developed ways to meet with our clients safely by phone and using these virtual technologies we've talked about today. And we've also coordinated with other agencies outside of the county, such as our contractors, community-based organizations, city officials, and healthcare agencies virtually. I think one of the notable accomplishments was our ability to meet and greet new and permanent, temporary and permanent staff virtually, and being able to provide them with training that kept them safe during their onboarding. Everyone's very familiar with Dr. Willis's daily updates, which became very popular and very crucial during our COVID pandemic. We conducted many forums and town halls virtually, and this allowed for greater than ever accessibility for all members of the community and allowed us to be able to get crucial messages and information out, as well as questions answered. We also shared information about essential employees and answers for specific industries. We've successfully transitioned our public assistance team, part of our social services division, to remote service without client impact. We opened up several additional call centers during COVID to support the community and be able to provide answers to many questions and to provide support. One major change during COVID was that the county started a new language line to add a video interpretation. And I think this is a great success story for our community. We've also worked with multiple agencies during COVID to coordinate resources such as food deliveries and other needed and vital services during COVID. Telehealth has been really, I think, a game changer throughout COVID. And telehealth, we've been using telehealth early on, especially for our behavioral health services through a video and virtual means, and also doing telephone, which allowed for the frequent contact between clients and providers. Telehealth reduced the feelings of isolation for many of our clients, and our behavioral health and recovery services were very instrumental in making sure that this use of telehealth became part of our norm early on. One of the things that we also did was initiate a contract with the Bright Heart Health for a virtual telehealth virtual clinic, which expanded our ability to provide services during this really critical time that, as you all know, has been very difficult on most of us. And we needed those additional services, and telehealth allowed us to do that through this contract. Another thing that we were able to do starting, I think it was in 2020, is the Help at Hand Innovations Technology Project, which is a project that Behavioral Health and Recovery Services use to actively engage older adults in using technology and developing digital literacy. And we also did some other projects where we obtained cell phones for facility-bound mental health clients who didn't have access to them, in order for them to stay connected with their providers and with their families. We also instituted phone consultations to boarding care facilities during COVID that allowed them to be able to have services ongoing. We've even obtained the TTY phones for the hard of hearing client to help improve their use of telehealth during COVID. I just wanted to tell a little bit about my personal experience with telehealth. Not just as the director, I've definitely seen a lot of great advancement of our use of telehealth as the Director of Health and Human Services. But I also have an older adult mother who I'm the caregiver for, and she has many health issues, and many doctors, and most of her doctors are actually still in the East Bay. And as you can imagine, during COVID, with my pretty extreme schedule, as well as our need to keep her safe, it was very difficult to get to any appointments. And my mother had a lot of fear about leaving the home during the pandemic. And so I would just say on a personal level, there were some challenges. I'm a baby boomer. I self-described baby boomer myself, and learning to use technology is something I've had to work a little bit harder to do. And there were some challenges early on with the video presence, but we worked together with our healthcare providers as well as with my mother to learn to use these technologies. And we have really seen a lot of positive benefits from using telehealth during the pandemic that helped maintain my mother's health and help her feel comfortable and safe. And it also helped with her connectedness during the pandemic, and also helped me to feel confident that I was giving her the best care. So the impact of technology on equity, I just want to mention that you know, we have in Health and Human Services started our equity journey back in a few years ago in 2018 with our strategic plan to achieve health and wellness equity. And we had a focus on leading with race in our health and in our strategic plan. So we have, in everything that we do, we try to put on an equity lens and try to make sure that we are meeting the needs of our community, and especially our community of color. And so, we have looked for throughout COVID, trying to identify gaps where we are maybe not meeting the needs of our underserved communities, and looking for opportunities to advance our equity agenda. And where some of the gaps that we identified were, you know, I think Dr. Chibas mentioned it, is the lack of in-person connection, the lack of computers. Not everyone has a cell phone. Not everyone has access to Wi-Fi, transportation, limitations that when the public transportation was not available, these were some of the gaps that we identified early for our clients, and that includes our older adult population. We look to fill the gaps with resources such as the multiple call centers that we established, having mobile units where we go out, as you know, with our COVID teams for testing, mobile units for vaccine, et cetera. Creating community hubs where we went into the communities to try to provide services. And of course, providing many virtual meetings. I think another success of COVID has been expanding our access through technology. And one example I want to mention that where we've learned some tremendous lessons, and that is with our community conversations. In the winter of 2020, we did 2 community conversations specifically to talk about services that were provided by Health and Human Services so that the whole community would know the things that we could provide, such as, Medi-Cal access and CalFresh and behavioral health services. We also talked about jobs available at the county because we do have, I just put a plug in, a quick plug, we do have many openings and we're looking for new employees. And so we had 2 community conversations that normally we wouldn't have the ability, prior to COVID, wouldn't have the ability to let the community know in a most direct way. We only had about 30 people that attended those sessions, both sessions, whether English or Spanish, whether it was the meeting about the HHS services or about jobs. We were disappointed, actually, that only 30 people showed up for these 4 meetings. But we were excited to see that later we had over 1,500 views of our videos, of our Spanish video on HHS programs, and we had over 337 views later of our video on pathways to county employment. So we learned that we can touch the community using this technology in a way that we never experienced before, and we certainly plan to continue to do that. And I would say that overall, the use of technology for Health and Human Services and the way we deliver care and the way we deliver services has been a game changer. We plan to continue to go forward with providing hybrid services. That includes in-person services for people that want to come to our offices, but we'll also provide phone services and telehealth services. And I think this has been really a great opportunity for us to be able to increase access to our services and most of all, to let the community know that we're here to support and that we want to meet them where they are and how they need to be serviced. So I'm happy to take any questions.
Thank you, Director McLaren. It looks like the county really pivoted, particularly in the Health and Human Services area during COVID to use technology in the most appropriate ways to get the job done. And so I really appreciate your comprehensive presentation. We have one audience member that's asking, how can they access county services?
It's a great question, and I really appreciate it. There are multiple ways, actually, and we're really excited, but there are multiple ways you can access county services. We certainly, encourage you to go to our website and you can go to marinhhs.org and look for the different services you might need, whether it's behavioral health or whether it's a social service. We have homeless services. We have, like I mentioned, all the public health services. Not just, and I want to make sure everyone knows that public health has done a tremendous job. And I meant to thank Dr. Chibas at the beginning for his great partnership with Marin Community Clinics. They've been a great partner throughout COVID. But our public health work expands beyond communicable disease investigation. We are doing a lot of work around public health preparedness. We are getting ready now for wildfire season. We have a lot of response. If there's a power outage, if there's any kind of emergency in the community, our public health team and the rest of our health and human services team stands ready to respond. If you have questions, specific questions, you can check with our website. You can also call our number. You can call our offices. For our older adult population, we have a specific number. It's 415-457-INFO. And you can call, 473-INFO, the number's changed, 415-473-INFO. And you can call to access all services for older adults. And that's a great number to call to get connected to most of our services in health and human services. But you can go on our website, call our phone numbers. You can stop at our offices at Kerner at 33240 Kerner, or stop at our building at 120 Redwood.
Great.
Or San Rafael.
Well, there are some other questions in the Q&A regarding connectivity, but maybe we'll save those for our next two speakers. For now, I just want to extend our appreciation, not only for your time and your presentation this morning, but for your ongoing support, Director McLaren of the Commission on Aging. We're proud to be part of Health and Human Services and work with your staff and really have a terrific relationship and really appreciate, as I say, all of your support.
I want to make sure that I also say, and I appreciate our relationship with the Commission on Aging and the Aging Action Initiative. As you know, we are 100% committed to our older adult population here in Marin, and we are thoroughly interested in our all of the opportunities to support our older adult population and to make sure that they can have all the services and supports that they need to live their most healthy and happy lives. And anything we can do to promote that agenda, we're happy to do that. Thank you.
Thank you very much.
Good morning. I don't see my video. Good morning. I'm Commissioner Lisa.
You're up, Lisa.
Yeah, my video is not coming on. That's so weird. Alan,
See you fine, Lisa.
do you see me? Huh, I don't see me. Good morning, everyone. My name is Lisa Brinkman. I'm the commissioner with the Commission on Aging also, and I'd like to introduce our next presenter. Dennis Rodoni represents the 4th District and is currently serving as president on the Marin County Board of Supervisors. Since his election to the board in 2016, Supervisor Rodoni has actively supported improving the digital access throughout the county. We're very excited to have him speak today. So welcome, Supervisor Rodoni.
Thank you, Lisa. And it's a pleasure to be here this morning. As Lisa said, I'm president of the Board of Supervisors and I represent District 4. And I am the board liaison along with Stephanie Moulton Peters to the Aging Commission. Lorenzo is joining me today and he's going to pull up my slides, I think. Thank you, Lorenzo. While Lorenzo's doing that, again, I want to thank all the presenters today and the Aging Commission for having this forum where we can discuss this important issue. My background, as we move to the next slide, please, Lorenzo, is that I'm a deeply rooted West Mariner, a 4th generation. My great-grandfather came to Olema in 1863 to dairy farm. I've been involved in my community, especially the nonprofit community of West Marin, working on many issues. The most important to me has been the restoration of the Jackimini wetlands with the Point Reyes National Seashore Association. I led that effort as chair of that board. Also was deeply involved with the Coastal Health Alliance, with our other nonprofit clinic in Marin, to get it federally funded, and also to help with the Kaiser contract, where Kaiser patients can be seen by the clinics in West Marin for at least one visit. I also was pleased to work with West Marin Senior Services and chair the committee that founded their 8-unit assisted living facility called Stockstill House. I was a general contractor in West Marin for 37 years, and that enabled me to do a lot of my nonprofit work, having a successful business there and on the coast. But I also served on the North Marin Water District for 20 years, which represented Novato and West Marin. I'm a longtime Olema resident of at least 28 years now, and a proud father of 2 adult daughters and 2 very smart young grandchildren. Of course, we all know our grandchildren are the smartest. My grandson in particular, just a week ago, turned 9, and he is particularly good at math. And he turned to me and he said, "You know, Papa," Poppy, he calls me actually, when I'm 60, you're going to be 120. And I said to him, "That's pretty old, Cooper. Do you think I could make it to then?" And he said, "Don't worry, I'm going to help you." But then right after that, his 9-year-old brain kicked in and he said, "Besides that, I need you to come to my Little League games." So he's planning on playing Little League for a long time. And I'm planning to live as long as I can. I was elected to the Board of Supervisors in 2016. And I really appreciated that I actually was 63 years old at that time, because I think it gave me a frame of mind and a sense of what was important in Marin to most Marinites. And so I focused primarily on prioritize preschool children, and then older adults, the environment, and infrastructure, including broadband. You're taking a look at my district, which is the largest geographical district in Marin. It's certainly the most racially and ethnically diverse, and it encompasses all 9 coastal communities, but 20 communities in total. So it has an interesting set of unique challenges representing that many communities and that large a population and that most geographically diverse population. And it also has a number of older adults, which we proudly represent. And it's very interesting because we often understand that the older adults on the coast in our rural areas have many different challenges than the adults on the Eastern Corridor, which have sometimes more services available. If you move to the next slide, please, Lorenzo. So what are the challenges to my district in specific, but to Marin County as a whole, and challenges in particular that affect our aging population at disproportionate levels? I think we all recognize these as probably some of the main ones. There's many, I would say many challenges that our seniors and aging adults face in Marin. Certainly the emergency and emergency preparedness is one that's been really important and highlighted since the North Bay fires. We recognize some of the reports we did on lessons learned from the North Bay fires, that our seniors were the ones highly impacted by the fires and the following smoke and all the other things that come with an emergency like that. But in particular, older adults were the ones that faced death the most in that emergency, primarily because they weren't prepared or they weren't able to get out of their houses or out of their garage. And so we're working very hard in our emergency preparedness to get seniors prepared, to get them prepared to one, to vacate if they're told to, but also to make sure in their communities and in their neighborhoods that their neighbors know that there's seniors there that may have disabilities that prohibit them from evacuating themselves, and who in their communities need help. And the counties work really hard to identify that population that would need additional assistance in an emergency. Throughout Marin, transportation is a challenge. Marin was not built for public transportation. It was built for the car, and as we get older, there's more and more challenges around us being mobile. We fortunately have fairly good systems on the Eastern Corridor with whistle stops and paratransit and other things. On the Western coast, though, that's limited. The accesses are limited, and sometimes it's only 1 day a week that some of those services are available. Certainly around housing, challenges with older adults certainly are having housing and staying safe in their housing. Many of our older adults are really land rich but cash poor. So maintaining their housing and paying for the taxes and the things that they need to get paid for, utilities and things like that, are a challenge. And so we recognize that. And I think that, quite honestly, one of the priorities that I have is that building more senior housing where our seniors can be safe in that housing and live long lives independently is really an important part. And I think it's pretty well accepted in Marin that senior housing can be built. And what that does is it frees up the other housing that the seniors live in for rent or for sale, providing actually supply of housing. And then the last thing, certainly the digital divide. The COVID has just highlighted the need for better internet for all of us. And not only better service, internet service. And I would say that Marin, almost anywhere in Marin, you can get internet service. It's the quality of that service that is important, and especially as we move to Zoom meetings and telehealth, the quality of that service is extremely important. And we're finding that Marin is mostly poorly served by high quality internet, and certainly our low income communities and our seniors are the most impacted, including our school children. Next slide, please. So Lorenzo helped a great deal, and many of you know Lorenzo. The Year of the Older Adult was something that I thought of early on, following what Sonoma had done the year before. And this is an important program to, one, identify our older adult population is really, really important to Marin, providing many, many important things to Marin. And we wanted to make sure that we recognize them, but not only recognize them with a year of honor, but also moved us to the next place in Marin, where we looked at how to be age friendly and how to develop programs going forward that better serves our seniors. This was a very successful program. Some of the people pictured here, many of you know, they took part in this. Supervisor Kate Sears co-chaired this with me. She was the liaison to the Aging Commission at that point. And we're really pleased to see the Year of the Older Adult kick us off into what we are into now, which is really growing the programs around our seniors, recognizing their importance to our community and everything that they provide to our community, and making sure that they're safe and taken care of, from everything from housing to health, and now looking at digital divide and internet. Next slide, please. So since I've been on the Board of Supervisors, working on internet broadband throughout Marin has been one of my priorities. I'm a member of the North Bay North Coast Broadband Consortium, which is a 4-county consortium which was formed about 7 years ago to really deal with the digital divide. It was recognized that our rural communities, especially on the coast, were poorly served with poor quality internet. But it was also recognized that there's also many areas within our urban areas that have the same difficulty, either poor service, poor quality, and certainly in many cases, the high cost of getting good quality. So this group, which includes Sonoma, Napa, Mendocino, and Marin, works together to make sure that we address issues from a 4-county perspective, a Bay Area perspective, Northern California perspective, and that we work together to seek grants, grant funding, to put us in better positions to get grant funding and have projects. Project spotlights from that group and the work that they do. The Nacasho Broadband Project was something done over the last couple of years, which brought broadband for the first time, good quality broadband to Nacasho. It was an extension of the George Lucas broadband, which he brought to his ranch on Lucas Valley Road. And I might add that he was very cooperative in allowing that to be expanded. But a grant from through this program that we're involved in came from the CPUC, which provided 2/3 of the funding with a local match of 1/3. This describes the Nacasho Broadband Project a little further. It was completed in 2018. There's about 250 locations in that West Marin village that are served, including households, businesses, other agencies, the school district, and the county corporation yard. And in particular, as part of that project, low-income residents had to be served at a very, very reduced rate. And so many of the community members that are living on ranches who never had any internet service for this project now have internet service, and it's a guarantee as part of this funding mechanism that provided the funding from the California Public Utilities Commission and the local match. And I mentioned the local match because that's a key sometimes in all our communities. Some would say, well, Nicasio probably could have afforded its own broadband. Probably true. But with the expansion and the opportunity to grant, we had to find a local match, and they had the capacity to come up with $1 million, 250 users to do the local match. And so that's the challenge with many of these grants, finding the local match. Again, before the program was terminated, I think in 2019, we were able to get Bolinas a grant for almost $2 million. And I'm pleased to say that project is now moving forward, serving the underserved population in Bolinas. And it's again CPUC funded with a third local match. Next slide, please. The Canal Wi-Fi project is the one that I'm most proud of. Because of COVID, we recognized that there were 2,000 children in the San Rafael school system in the canal that didn't have good internet. In a very short time, a small group of people got together and put their minds to the paper, led by the county IST, Lisa Massey and her group, who worked with the MCF, the county, and the Canal Alliance, San Rafael City Schools, and the city of San Rafael to put 20 hotspots in the canal neighborhood, which could serve all the children going to school with high speed, high quality internet. And then the side benefit of it all was that the community in that area also got to use the internet. So families who had kids were able to actually use the internet through their children and be trained and helped by their children. But the whole community was able to access these 20 access points with free Wi-Fi. And that only happened because of COVID. If COVID hadn't happened and school children needing that service to get their schoolwork done, it wouldn't have happened. And I might add that there was private donors that made the difference there. About a third of that project was privately funded, including MCF. The Bolinas Stinson School District also had a similar problem. They discovered that 75% of their children were underserved when it came to internet and weren't completing their schoolwork. So a local nonprofit that belongs to the school district, MCF, the county IST, and local donations were able to put together a program where all those students now are being hooked up to good quality, high-speed internet through two providers in Bolinas, Muir Beach LAN and Horizon Cable, at a very, very low rate for 5 years, guaranteed with the funding that we put together. Next slide, please. I'm having a little, there we go. So we're deeply committed to infrastructure, and in particular, deeply committed to the digital divide. We understand that there's a lot of challenges, though, with moving forward with this, mostly around funding. Certainly broadband, which is our desired wish, is the most expensive because that's where you have to put cable in the ground or on telephone poles and hardwire people's homes. We think that that's a very dependable, high quality, and stable way to do it. However, we realized that during COVID that getting stuff done, sometimes we have to depend on wireless and hotspots like we did in the canal. But technology is changing, and we expect it to continue to change. But we also believe that we have to continue to work on our broadband issues. And I'm pleased that Marin, through Lisa Massey, who you're going to hear next, has kicked off the Digital Marin, which is first, and it's also been in connection with the North Bay Broadband Group, is really the backbone of determining what is needed in Marin to provide good, high quality internet service, and what's their path forward into doing that. And so I know you're going to help her today and answer some questions, but we all have to be engaged in this issue. It's a huge challenge. It's only been highlighted by the pandemic, but we've known about it for years. We actually have reports showing where poor quality service and underserved people are in Marin, and we're sort of one by one addressing some of those issues, but everything we've done to date is really short term. We need to work on the bigger plan and make sure we have the backbone in place to provide high quality service into the future. So I'm really happy to stop there, answer any questions, and great to have Liza follow me and give you an update on Digital Marin.
Thank you so much, Supervisor Rodoni. That was really great. I'm really excited and pleased to hear that you have that focus on something that's so practical and real for our everyday lives. Not having a good internet connection and not addressing the digital divide leaves so many people not just without healthcare but really isolated. And that's one of the key issues that are facing older adults with and without the COVID pandemic. So we really appreciate that. I do have a few questions. One is kind of a follow-up. Liza might be able to answer it as well, but we had a specific question about, is there any effort being made to kind of secure the copper landlines? Because most of the internet companies, most of our telecom companies are very quick to pull them out. And often those copper hardwired landlines are actually the safety net and for many people, because it's the only phone system that works, especially when the electricity goes out.
Yeah, that's a real challenge, Lisa, and particularly in the West Marin area, which is served by AT&T, because their business plan, AT&T's business plan really is eliminate all hardwire for phone and internet. They want to go totally wireless or totally your phone connected to your internet, which doesn't depend on that hardwire anymore, and it actually doesn't provide service when there's power outages. I don't personally think that's a great idea, but unfortunately, it's a federal government control that controls that. The FCC controls most of those decision making, and quite honestly, many of our struggles around internet with AT&T has been that they are just way too powerful in their lobbying, that they are so successful in getting what they want. And sometimes it's not the best for all of our community. Their business plan is serving the high population areas where many people can tie into their services. And their commitment to the government is, well, we'll go to the rural areas, but if they don't want what we're proposing, we don't have to serve them. So in terms of the coast, many of us don't want additional towers and things on the coastal zone. And so those communities have a hard choice to make when it comes to ATT, maybe their only option, but they're only proposing it in the way they want to do their business plan, which means 5G and things that we may not want and find desirable in our community.
Yeah, thank you. I also have a personal experience. My folks live out in a rural area, and I actually had to get them a hotspot satellite connection because there was no cable or broadband anywhere. I have another question, and it's a follow-up on your commitment to the Year of the Older Adult. This person really thanks you for that. How is the county educating its employees to maximize the benefits of telehealth for older adults and balance that so that we're not really further isolating older adults by kind of putting them in front of a screen and saying, kind of work with this as opposed to getting out in the community?
Yep. Yeah, one of the challenges that we've discovered as we've rolled out good quality internet to many of these communities was that many of the people in those communities are not trained in technology. And so we can't neglect that as we go forward, that there has to be some training associated with rolling out new technology and making technology available for normal business at the county. Couldn't say we're specifically focused on seniors, but we're focused on the population as a whole to make sure that they're positioned and we're positioned to better serve them using technology. And so, I think there's a lot to be done, both on the user side and on the county side. And you have to remember, this is all new to us in the last 12 months, pretty much, even from the county's perspective. While we've been using a lot of technology more internally, we haven't used a lot for an external business. And so this is all new to us. So there's a lot to be done. And I think that we probably need to start depending on our teenagers to help us provide that technology. That I know where I go to when I have a computer problem, I go to Lorenzo, because he's the young person in our office who's technically savvy. And I think so, matching up, I know intergenerational places are matching up high school students with seniors to help them learn how to use technology. I've been really impressed, though, with all the Zooms I've done over the last 14 months. The number of people, especially older adults, who have been able to use technology to their advantage and attend meetings and ask questions, I've been really, really impressed. But there's an audience out there that haven't had that advantage of the training that needs to be done. Example I would give you is that the recent rental assistance apply-a-thon, it was discovered how many people didn't not only have phones or computers, didn't have email addresses even. And so that was a bit of a shock, but we have to remember that there's a lot of people that are way behind when it comes to technology.
Yeah. With the potential infrastructure funding from the federal government, are there shovel-ready plans in place to do some more long-term fixes?
So the challenge for Marin, and I think you're going to hear this from Liza, is that we're probably going to have to do some work on our backbone, which is the infrastructure that provides internet to Marin. We have some gaps, I think, in Marin. She's going to talk about that, and that probably is part of the challenge for us going forward. And in particular, West Marin lacks a trunk line, or a main line, I would call it. We've got it to Nacasho through the Nacasho project, and that plan was, if that grant funding was available, to bring it out to Point Reyes Station and then go north on south on Highway 1 to connect the whole West Coast. Unfortunately, that grant program was stopped by CPUC with a great influence of AT&T. To want to do their business plan in West Marin, not to have broadband in West Marin, and so that makes it challenging to have shovel-ready projects, because you don't have that backbone in place to actually do the projects. In Bolinas, they were able to piece together some wireless backbone systems from a couple different directions. In one case, they had to go under Bolinas Lagoon from Stinson to Bolinas with a wire. Which was quite challenging, and permit-wise was quite challenging. So that's really the issue, and we really don't have a lot of projects that are shovel-ready because of that. But we have, with the Digital Marin Plan, we're going to have in place the plan to be able to do that. I think will put us in a much better position. But I would add that federally, from the federal position and from the state position, we've never been in a better position for funding. There's tons and millions of dollars that are being put in the case of federal government, perhaps even $1 billion being put into broadband and internet service. So we've never been in a better place. And that's why this consortium is so important, because we think as a group, we can attract some of those grant funds.
That's great. I've got one question which kind of goes into the G5, and this person in particular, and I'm sure there's others like that have like medical health issues with regards to exposure to the electromagnetic fields and radio frequency. And, they're concerned for their personal health, but also maybe for the health of our future generations. Is there any studies, or is there any work being done, or things that people can do kind of to protect themselves from that G5 radioactive? I'm not sure I understand it completely myself.
Yeah, well, certainly individually, the best protection for you is to avoid wireless and avoid 5G installations. Sometimes that's hard to do, especially if that's the business plan for some of our providers, to put 5G throughout your neighborhoods. Individually in your house, though, the best case for you would be have a broadband connection, a hardwire connection for your internet. and that would minimize your exposure within your house. But again, if 5G becomes widely accepted or widely installed throughout your community, it's hard to avoid it. The County of Marin has very limited authority over 5G. We have a telecommunication policy where we've tried to keep it away from childcare, schools, hospitals, places like that, and has maximized the distance from those facilities before the 5G could be installed. But so it's coming, and I think that I'm not sure that our broadband approach can offset it, because broadband is really pretty far behind, and it's, like I said earlier, a very expensive way to address the issue. But I think the medical issues around 5G and all sorts of things, I mean, even your cell phone has some risk to it if you keep it next to your head for great periods of time. I think that those are all real, but I think at this point, the government, federal government, until there's new appointments out of the Biden administration, is not looking at those things very seriously.
Okay. That's all the questions we have for today. And we so much appreciate your time and all the work that you're doing on the digital divide. It's a huge thing. And just the fact that you were prepared to support it when we needed it most is very commendable. So thank you again, Super Rodoni, for taking time to participate today.
Yep, and I need to reinforce that there's many community partners that played a role in any of these successes. Because of the expense, MCF has stepped up, Marin Community Foundation, every time we've had a project, as have local people who have donated to the projects, and it's really wonderful to see that support within our communities.
Yeah, thanks. That's great. Thank you very much.
Thank you.
Our final speaker today is Liza Massey, Chief Information Officer for the county. Ms. Massey manages Digital Marin, a collaboration of residents, businesses, government, education, and nonprofits formed to develop a countywide roadmap for improving internet access, disaster resilience, data sharing, and digital services. That's a lot. Welcome, Liza, and we're really excited to hear about the Digital Marin project.
Thank you, Lisa. And I'm going to share my screen now, and hopefully everyone will see it very soon. I appreciate the opportunity to be here, and I truly appreciate the opportunity to talk more about Digital Marin. I encourage everyone to visit if you have access, and I think if you're on Zoom, you probably do. GoDigitalMarin.org. You'll see the website address over and over throughout this presentation. You can certainly access it on your mobile or cell phone. There's a lot of information there, and I'm not going to certainly be able to cover all of it today. I, again, appreciate the opportunity to get here. I'm going to conduct a few polls to get this started, to get the audience involved in providing information, and then we can compare it to what we have found so far. So the first poll that I'm going to launch is really asking you about how you would rate your digital literacy. And this is your understanding of computers, your understanding of the internet, your understanding of apps and services. So if you could just fill that out very quickly, I will wrap it up. When I mentioned I want to compare what your experience is to others, it's because we have just finished a lot of community outreach. I'm going to stop it in a few seconds if we don't get some more people to answer, but it looks like y'all are really moving the numbers up. And so far, good and excellent are outweighing the other options. And so that's really nice to hear, but I will say that some of it is because you're online now. So I'm going to end the polling. It's slowed down quite a bit, and I'm going to share my results with you. And certainly, good was the winner overall here. And that's nice to hear, but not really surprising in our community. And I'll show you why. We looked at some statistics nationwide, and you can see what those are on digital literacy or frankly, people who don't have strong digital literacy. And if we just took that percentage and looked at it in Marin, that would put us at the number you see. But as we did our resident survey, it was an online survey, we found that the respondents felt that their ability to live in this increasingly digital world is good or excellent. And so I imagine that our issues with digital literacy aren't necessarily as high as those in the rest of the country. And that's good news for us, but we have other news. I'm going to launch a second poll, and let's see, we're going to do a second poll around your own experience with the digital divide. And we're going to talk about that today, but have you ever experienced this? And it could be just not knowing how to use it. Your device isn't what it needs to be. Your internet service is unreliable on a regular basis. And so I'm going to ask this, and frankly, it's running about 50-50. I know for myself, I live in Corte Madera, and you would think we're all wired up, but I'm a couple generations behind on the technology that I can purchase. I would pay more. And so, you know, it isn't just a total lack of service. It could be underserved. It could be that our infrastructure is aging, has already been pointed out. And we have those that, you know, once a few people get online from a household like we've had to, we find that, you know, we can only do 1 or 2 people at a time, maybe just one. And so it looks like it's about 50-50 here in terms of experience of digital divide. But if you look at what's happened around the world, around the US, I mean, you know, almost a quarter of people don't have broadband, and broadband is just defined as high-speed internet. But if we look in our own communities, almost 40% of Canal residents, when we did, the city of San Rafael did quite a thorough survey, almost 40% didn't have internet connection. And that's not high speed, that's just any speed of interconnection at their household. And so we do have communities that are significantly impacted by the digital divide. And as we did another survey with our Health and Human Services Department that you heard from Benita, and many of our community-based organizations that provide public and social services, we found that the digital literacy level of their recipients is fairly low and was rated mostly either fair or poor. And then we also found out of that group that almost, you know, a quarter of their recipients don't have access. So when we had to shelter in place, imagine how difficult that was, not just for telehealth, but other services that could be provided online, but you're leaving a quarter of individuals out who need those services and can't access them. So that really led to some questions a little over a year ago, pre-pandemic, you know, thinking through government services, which I am the Chief Information Officer for Marin County. And I want to thank Supervisor Rodoni for his support for all the work that we do in this. And as a CIO, we have a lot of technology that the county uses, but increasingly we're providing our services online. And so it isn't unusual now for local government to say, okay, if we're pushing services online, we need to make sure people can use them. And so this idea of having a plan that really answers these questions, certainly about high-speed internet, available, you know, the wires and Wi-Fi, I call it, but what about the ability to use it, the knowledge, the equipment, the devices, even just the services that make sense, getting rid of other barriers. What if you have a language barrier or you're a person with a disability and there are barriers? You know, what if we got rid of all that and everyone could access the internet? Well, that's the genesis really of the Digital Marin Project. It started out with a proposal to the Marin County Board of Supervisors to create a digital infrastructure strategic plan, but that's a mouthful. So we named it Digital Marin and we branded it on its own, not as a Marin County effort, because we have brought together people from healthcare, from business, from education. Residents have been very involved, you know, certainly government. So all across the sectors in Marin County. And it's been a really wonderful experience to bring these people together. And as we're developing a strategic plan, a roadmap for Marin, all of Marin, we are looking again at that full picture, not just can we build, put fiber in the ground, but we need all of the pieces, affordable internet services or free internet services, literacy, et cetera, remove the barriers so that we can have bridge the digital divide, but not even that, let everyone prosper and take advantage of the opportunities that the internet provides us. And if you look at Marin, a lot of people do not believe that we have much of a digital divide, especially with totally unserved people. But we do. Supervisor Rodoni mentioned a couple areas, but we actually have 5 that the California Public Utility Commission designates as unserved or underserved. And those are a couple you mentioned, certainly West Marin around Bolinas and Stinson Beach, Marin City, the Canal neighborhood, and there are a couple of pockets in Novato who are unserved or underserved. If we look at just a regular speed that a lot of people would get for their internet, not even the fastest, that unserved and underserved number is over 4,000 households. And if you figure that not all those households have one person, it certainly is impacting in the thousands, the number of residents we have that either have no high-speed internet access or very poor, mostly unusable. And so as we brought this project together, we knew we needed to do significant community outreach. And we needed to address many of these issues that we've talked about that COVID has brought up, getting people online because they can't go in or they don't want to go in, or some of the other examples that you've heard today. We also found that in addition to those 5 geographical areas, we have a 6th, what I call area, that is underserved and sometimes unserved. And those are our older adults, for a variety of reasons, not because they don't want to, but all the reasons we talked about with the digital divide, and then people with disabilities. Digital accessibility is a requirement by law, but it is not ruled out here or most places to the level that it needs to be to ensure that anyone at any age. And if you look at the population of Marin, I already mentioned those over 4,000 households, we have nearly 60,000 or more residents who are over the age 65. So we could certainly be leaving a good number of people out. And if we look at the estimated number of people with disabilities, it's nearly 13,000 under 65. And so we don't want to leave those people behind. So they've become a very big part of the research and the community outreach that we're doing. We already mentioned fires and other disasters. They're driving this, not just the need for people to do access at home. We know when we had that protracted outage that many of us lost all of our services. And then Supervisor Rodoni mentioned that they're funding opportunities. The Marin as a whole, not just Marin County, but the cities, towns, businesses, residents, we've really missed out on funding that's already been available because we haven't collaborated and worked together to have projects or shovel-ready plans in place so that we can apply for these, because much of the funding is competitive and we've just not been competitive. And so Digital Marin really wants to get at that. Right now, California is looking at $7 billion for broadband over the next 3 years. The federal government in its last American Rescue Plan funding says you can use it on broadband, and the cities and the counties are getting a significant amount of that funding. The county's getting $50 million alone. Now that sounds like a lot of money, but as Supervisor Rodoni pointed out, that would not even do the build out that we need across the county to bring broadband to everyone. But there are options. And then there is the couple of $1 trillion bill that's or plan that's floating around that the federal government's hoping to pass. And it includes billions for broadband. So we need to be ready. And that's why we're developing this plan. So in terms of the Digital Marin plan, we are treating it as a project, and we've already completed several steps that you see. Right now, we're doing a lot of data analysis, looking for gaps and themes so that we can write the plan. We want public review, and we've had a lot of public participation. We've had, I'm gonna look at my numbers, we've had nearly 2,200 people reply to surveys, and not just online surveys, but we went to the communities where people weren't served or underserved or didn't want to answer an online survey necessarily and did more. We've had over 385 people in work groups and focus groups and one-on-one interviews. And then we have over 350 people who've gone out to godigitalmarin.org and subscribe to our weekly newsletter to stay up to date and to stay part of the project. And so right now we're looking at pushing 3,000 people who have been participating in our efforts. And we love that and we want more. I talked about community outreach and the different sectors are involved. And this just shows you an overview of how we've divided up Marin. And we've gone out to divide and conquer to get community input, but we're bringing it back together because we know there's common themes and there's overlaps. You'll see that we have included the internet service providers. They've been interviewed and provided some information. They don't provide everything because of being competitive. We don't want to leave them out because we don't want to set this up as us versus them. But we do know that we can no longer leave it up to them to build out across all of Marin. It's just not economically viable. We do know they have those lobbyists, but across the country and even here in California, local government is being enabled more than I have seen in my over 30-year career to put in municipal broadband or do public-private partnerships so that we can get internet for all. I'm going to run another poll, and this poll goes with some of the other questions that we have asked. And so I'm going to stop sharing results. I'm sorry if those stayed on your screen. I'm going to do a third poll about how would you rate your primary internet service? So not everywhere you go, but if you had to do an overall rating, how would you rate the service that you get that you use most often? And so I appreciate that because one of the things that we've asked our residents, particularly in the online resident survey, is how they would rate it. And you can see that that the US overall hasn't done the best in internet speed. If you look around the world, 11th is a little surprising with us being, one of the powerhouses in the world. And I'm going to go ahead and stop this and show it, and then I'll stop sharing instead of moving along. And so here in Marin, though, we found out that, okay, there we go. We found out that 36%, so over a third of people with internet who replied to this online survey said that their internet slows to unacceptable levels, meaning they can't stay online 1 or more times a week, some people every day. And I can tell you there are some weeks that I personally experience this. And you can see I do presentations and all my work on Zoom from home right now. It's very difficult for all of us to operate. And then you add that on to the people who are unserved and underserved, and you're starting to get quite a bit of people who are struggling with internet. So even though you hear people say Marin is relatively wealthy, they're near, a major telecommunications hub, San Francisco, we still have many issues across Marin. And then you can see that this was interesting. We're still looking into it. 55% of the people who responded to the polls rated their services good to excellent, but you just saw a third of them are having problems. So they must be in that other group. But when you ask about price, we had over 40% of people who said they really are paid too much. Our prices are bad or terrible. This chart, I think, really puts it all together for us when we ask about what it cost in speed and the speed and the reliability. And only 11% of the people who responded said, you know what, I don't need to pay more. My internet service is fast and reliable. But if you look at the 26.5%, they're in that good enough. So they're probably part of that larger percentage that said it's good, good enough. But is good enough all the time? And as technology is requiring more and more bandwidth. And then, you have this almost 30% who said, I need more, but I can't afford it. And so this chart is very telling about where we are in Marin overall from our survey respondents. I'm going to do another poll, and this poll is another question that we asked our that we asked our in our online resident survey. And this was, how do you most often use the internet? And so I'm going to let you all have a few seconds to answer it. And then I'll show you some of the things that people said to us. If you could answer the poll. Here we go. It's starting. The numbers are starting to jump up. Right now, work is leading, and I think that's because so many of us are working from home these days. But now communications is pulling ahead. And I would say that if that is the final answer, that communications and work are in the top, I'm gonna go ahead and end it and share it with you. It is just like we found in our resident survey and in other surveys that we found that most people found that they were doing communications and social media, so email and those things. But you can see the other things that rounded out the top 5, telework being one of them, and shopping. And so you didn't see telehealth, and I want to talk a little bit about telehealth. You've already heard from it from the doctors and others, but I want to look at it in terms of the digital divide. On my left, you see that patients feel, over 80% or almost 80% feel they can get quality service. They want to continue with telehealth in some form. And remember, that's the broad definition. Our insurers have paid a significant amount more for telehealth services in the last year. I mean, imagine double to 10 times as many claims. And then the doctors are really thinking about continuing telehealth. And one of the big areas, the 75% of the time, was chronic disease management. But there are issues that are related to the digital divide that we need to work on. Certainly the typical, do I have a device? Do I have internet? Do I have those things? But security and privacy are big ones, consumer or patient buy-in, licensing. So some of this gets at what we would traditionally define as a digital divide, and some of it really goes even beyond that. The divide is not just in the recipients, it occurs with the providers too. So I'm going to launch one more poll. I appreciate you all doing that with me. I only have a couple more. Generally, how do you feel about using online services? You are using them to work, and you're using them to have entertainment and communication. You may be using them for your telehealth. And so, we're looking at these things. Do you have barriers that restrict you? You really don't want to use them, but you will. Or you want more, you're happy. And we asked the same question to our residents in our survey there too. So I'm gonna give it just a second. And, we look like, I'm happy to use what's available, but we still have some people who can't access them very well. And those that a few want more. And I'm gonna go ahead and stop it because I wanna make sure you have time to look at our time to ask questions, but you can see the curve here from, I really can't use them because there's issues, through a few people wanting more. And I will say that this almost directly is in line with what we found. Remember, 25% can't access them, according to the providers we surveyed. 25% said, I'll only use them if I have to. And that was kind of around what you said. 47%, the majority, said they make good use of them. Those who want more was, very low, like around 3% that you found. And then one more poll, and then I'll just wrap up and we can get to questions. After COVID, so when you can go out and go to the doctor and go to work and go all those places, how often do you want to use online services? And this was a question that we asked our providers, our healthcare providers in our community-based organizations. So I'm interested to see how you all feel about using those services, because we asked them to, we've asked others to tell us what they're thinking. Okay, so I'll give it a couple more seconds. These are interesting. Okay, and this is a portion of you, not everyone is answering, but this group wants to use them less. And so, you know, that isn't necessarily what we found. We found that the majority for the providers, as they looked at their recipients, that almost half of them said they continue to use them. 32% they say they want to expand those online services because people are making good use of them. The 45% said, you know, we're going to at least leave what we have. But another about 23% said they want to decrease them. And so, you know, those of you who would rather use less online services, that's fine. But think about the future and the ability to, in a disaster, or you can't get out of your home, or, you know, it's not convenient to go because of some issue. If we start decreasing the online services that we put in place even now, we really can leave people behind and reduce the number of options people have. And then I'm just going to end with this, and I don't think we have a ton of time, but this was the demographic of our survey respondents. They were two-family households. You know, they use Comcast for home. They have home phones. They own their homes. They use Verizon for wireless. Many of them were in their 60s and 70s, which was a little surprising to us in terms of having that be the majority of respondents. And then most of them had a bachelor or a degree or above. And so now I'm happy to take questions. I think there are a few of them, hopefully, for me to answer.
Thank you, Liza. If you can stop sharing your screen, they can see us both. We have one good question here. We have many questions that are all good, but this one is particularly interesting. As we're creating and encouraging more senior housing and affordable housing, are there requirements in Marin right now that they implement some digital access strategies so that those senior housing units have internet access available to them when they move in?
You know, that is a great idea, and I appreciate the question. It is not in place, but I call that an outcome of this plan and a recommendation that is low cost or no cost. It would not take us a whole lot of effort to put that into our approval process. We are looking at retrofitting some of the public housing that serves older adults and persons with disabilities right now. But those are the kind of ideas we can implement those. Those don't cost millions of dollars. They don't cost thousands of dollars. Now, will the builders all love it? No. Will the people that rehab them all love it? No. But I think we've got that public push to make broadband available for everyone now, like we haven't ever had before.
That's great. Thank you. The next question is, what preparations are being made so that there's a limited or no, that's impossible, but internet disruption during the fires? And we especially experienced that during the power outages, even without the fires, where some communities were without any internet for a week.
Right. There's a couple of things happening. California has legislation now requiring that there's power generators and backups at certain sites to keep the wireless infrastructure running. There'll be more of that. And so that's part of it. Part of it is redundancy, having the physical infrastructure, wires on the poles, wires in the ground, and backup at the critical junctions, but also wireless. Having that available maybe as the last mile. There's radio still. So there's a lot of options, but we need that redundancy because we were definitely caught off guard with the 3-day power outage.
Thank you. Do you have somebody specifically on your executive committee that's representing the older adult community?
Right. We do not have someone on our executive steering committee that is tied directly to older adults, but we've done a lot of work like with the Marin Commission on Aging. Our residents committee, though, is totally made up of older adults from our community that interact with many of the organizations and the agencies that we've seen. We also have done particular outreach to older adults, including in-person focus group recently with our older adults and people with disabilities at one of our public housing residents. And so the answer is not, someone from the Commission on Aging, perhaps, but we do have that involvement. And our residents committee, frankly, is one of the biggest work groups and also the most active.
Great, that's super. The digital literacy question has come up a couple of times in the questions online. One was in line with the senior housing is, are there maybe suggested training programs that could also go to our senior housing within Marin on digital literacy? Because it's pretty frightening when you are starting something new, especially with the computer, and not knowing the difference if you made the mistake or if the computer is crashing on you to begin with, and then how to actually use that device that you're getting as the software continually gets upgraded.
Yes. Part of the plan of the recommendations, I can tell you already, are around digital literacy. And if we want to provide broadband, for instance, to older adults, we can't just say, okay, you have a wireless now, go for it. We have to complete that whole circle of devices. Literacy is a big piece of it. What we found through the research and community outreach is that there are lots of digital literacy programs, but it's very difficult to find one, to know if it's right for you. How is it offered? And so part of Digital Marin, and this is another low cost, no cost project that will be recommended, is to inventory, coordinate, and expand digital literacy programs. So it's very easy to find one that meets your requirements, is delivered the way you want. Otherwise, we just have this patchwork and many people are left out.
Yeah. We had one specific example that came with one of the YWCAs. They have the free computer trainings for 50 and older adults that are looking for employment. So it's not disaster recovery or internet telehealth, also every aspect of your life. One specific question was specifically about Novato and the plan, because apparently it is on the next phase of the digital divide planning. And this participant had wondered if there's a projected timeline.
There is not a projected timeline to work in Novato specifically. I will say we started with Canal District supporting that project because it started by the city of San Rafael. We quickly went to Marin City because they had a community group that came together, and we are supporting them. We're out in West Marin because of people like Supervisor Radoni, but they had a community group. And what I have had very much trouble finding in Novato are people who say, yes, I know where those two pockets of unserved or underserved, or I know students at this school. We need a community group there or community leaders to work with us to identify those. And it's the grassroots community that tells the story, helps us find the data, that then gets the funding, because that's what it takes. And so if anyone knows more particularly around where those pockets are, because the data we have from the CPUC is very general. It's like in this zip code. Well, Nevada only has 3 or 4 zip codes. So it's really hard to narrow that down like we could the other areas. But as soon as we know, we will work with a grassroots leaders or some kind of committee, because we need that skin in the game, or the funders they don't come forward.
Okay. So all you from Novato out there, Liza's looking for volunteers. I would assume that would be the same with the pockets within the county, that, there's little pockets. I live in Tam Valley, and I know that there's pockets in the Hill that once you turn the corner, your internet's gone. And then you turn a different corner and it's back again. So any information that would help you I'm assuming would be really valuable.
Right, and we have found that, and that's why I say we can focus on these 5 areas that have been identified, but there are a lot of areas around Marin where if you go up a hill, or like you said, or there are areas, frankly, like Mill Valley, which is very connected at the base, but you turn the corner and you go to the subsidized housing, Kruger Pines, and it just wasn't economically viable at that moment to bring broadband there. like we might have in some of the wealthier areas. And so we're actually working with them right now to see what we can do. They were the very first people to reach out to us, very first when we put the website up, a representative there.
One of our participants had mentioned that the North Marin Community Services might be a good place to get some information about the Novato.
Yes, they're on my list to follow up, but we really need a group too.
Perfect, you're on top of it. Well, thank you so much for your time. It was very insightful and encouraging. The project itself is fantastic. And we appreciate you taking the time to explain to us how it's working and how people can get involved. So I would encourage people to go to that godigitalmarin.org website to get more information. So thanks a lot, Liza. We really appreciate
All right.
it.
And thank you again for the opportunity. I appreciate everyone and your questions.
Take care. Bye-bye. As we conclude today's webinar, I'd like to extend a very special thank you to our presenters for sharing their expertise and insight this morning. I think it was a very valuable session. We would also like to extend our appreciation to Lee Pullen and his staff at the Aging and Adult Services, as well as Ralph Marchesa and the entire Commission on Aging for their support. Most importantly, we thank you, the community, for your time and participation today. And we wish you a wonderful rest of today and get outside. It's a beautiful day. You can log off now. So thank you very much.